Hi, I'm Dr. Ron Gardner. No discussion of shoulder arthroscopy would be appropriate without first discussing the things for which shoulder arthroscopy are done. Now, there are loose bodies in the shoulder that can be removed. There are little shock absorber tears called labrum tears that can be trimmed out or repaired. The biceps can have a partial or a full thickness tear. But the most common reason for shoulder arthroscopy are those problems associated with the rotator cuff. Either a pinching, called an impingement, or a partial or full thickness rotator cuff tear, which can be trimmed and or repaired both arthroscopically and the most common fashion, which is called mini open. Now, there are some other things for which we do a shoulder arthroscopy, like instability, but those are pretty uncommon and really won't be discussed in this discussion here today. Now, before surgery, of course, we're very careful about getting a good diagnosis. The better outcomes after surgery are those outcomes associated with full motion before surgery. So you may be asked to go to therapy prior to surgery to get all your motion back. Now, once in the surgical setting, normally we do an arm block so that a person requires less anesthesia to keep them asleep, and also so they wake up easier with less pain in the arm. That's done by the anesthesiologist before we go in the operating room. The surgery itself is done under general anesthesia. It's usually 3 or 4 puncture holes, and the puncture holes are so small we don't even put stitches in them. After surgery, you'll be in a sling. You'll go to physical therapy most likely the very first day or the second day after surgery, because we really don't want that shoulder to get stiff. And for the first 6 weeks or so after surgery, that is our primary concern, is to return the motion to the shoulder. Once the motion is returned, then we go after functional recovery, which is usually strengthening, but can also be velocity training. If you don't have a rotator cuff repair, it's about half the time for recovery as opposed to someone with a rotator cuff repair. Motion is more difficult to recover after a rotator cuff repair. In the immediate after surgery period, called the postoperative period, of course, we'll have you on pain medication, and you can't drive on pain medication because that's considered driving under the influence. So you'll need to have somebody else drive you. And even after you're off the pain medication, you'll need to make sure that if you're driving, you would be okay. If every other driver on the road were just like you. So kind of use that as a self-test. Now, there's no such thing as surgery without risk. This, like every other surgery, has certain inherent risks. Giving you anesthesia of any kind. We're always worried about infections. You can get a blood clot in an arm. You can get a blood clot in a leg from decreased mobility after surgery. We're worried about everything from infections to wound healing problems, but stiffness is the big one, with residual pain, possible instability, and the surgery just failing to get you the desired outcome. We don't expect any of those things, and the overall major complication rate from shoulder arthroscopy is less than 2%. So while we're required to tell you about it, it's really not very common. Now, every other surgery has its own peculiarities, and we'll be happy to answer specific questions dealing with your surgery as long as you have that general outline.